So anyway, the idea now that we're jumping into is to discuss another critical element of human rights, and that's really to talk about the opportunity for digital to be not only implemented, but really implemented well in underserved areas. And we have them here in our backyard in New York City. We have them across the country in Pennsylvania, in Kansas, and New Mexico, and Texas. It's really something that every public health professional is looking at carefully and trying to understand how to meet these needs. And it's across the board, whether it's women's health or addiction health or mental health. There are significant needs here. And thankfully, we have a tremendous colleague in Fran, who's going to do a tremendous interview here with someone again, Shawnte, on this important topic. And we're excited to welcome them both. Fran, handing the virtual podium over to you.
Excellent. Thank you so much, Stan. Appreciate your reflections there. Quite true, quite true. And I'm very honored today to be able to introduce you to Shawnte Elbert, Dr. Shawnte Elbert, who is the Associate Vice President of Health and Wellbeing from the Ohio State University. Thank you so much, Dr. Elbert, for being with us today.
Thank you all for the opportunity to be here. Happy to join you all.
Absolutely. Let's go ahead and kick things off because just as Stan mentioned, there are a lot of challenges that we see here in the United States, and one group that is often overlooked are students on campus. And we'd love to talk to you about the work that you're doing. So why don't you tell us a little bit about what you do and how you're using digital technology?
Absolutely. So a brief high-level overview. I am a college health professional. My background is in health education and promotion. And now as an administrator, I have the pleasure of serving as the AVP here at Ohio State, where I have student health services, recreation, counseling, and consultative services in our Student Wellness Center in my portfolio. And then I also work with our program manager to look at our student life, employee well-being initiatives for our staff and graduate and professional students. And so my focus is looking at our comprehensive approach to student health and well-being and our strategy, especially as an academic medical campus, but also because we have 5 regional campuses, on how we support our entire campus cohort in supporting our students holistically. And so that is in a nutshell, what I do. And then for fun, I teach public health courses at Tulane's MPH program. So that is a brief overview, Fran, of what I do for fun.
Well, it's definitely brief, but it's quite a bit that you're doing, and we greatly appreciate you for taking time out to meet with us today. Let's first start kind of diving into a sort of a definition on what makes up students, because I think there's this perception that it's only folks from the ages of 18 to say 24 years of age, and that the only life they have is the life that they know on campus. And I know that's perhaps not true today, right?
Absolutely not. We have our traditional age of college students who come right after high school, but then we also have what we call non-traditional students who come after 21, 22. And then we have our graduate and professional students who are in our academic programs, which may consist of nursing, law, pharmacy, veterinary school, and any other graduate and professional students. And then we have our students who may be caregivers. We have our international students. And then we also have students who may be considered DACA. And then within all those other aspects, various identity-based groups who are also students here, where we have to consider all of those components, such as our rural students, our first generation students. And so when we look at our student populations, while they bring different components to us as far as identities, being under-resourced, my focus when I look at it is how they have potentially had access to resources or our lack of resources around specifically those social determinants of health, and how we can use our technology on our campuses. And for some of my colleagues, the lack of technology on their campuses to support those students who are historically under-resourced and under-supported.
During the pandemic, of course, there was some focus on students and their health and well-being as it pertained to the pandemic itself and COVID. But certainly the reality is there conditions that students are dealing with all the time, where campuses are stepping in. And another area, behavioral mental health, of course, being one of those areas, the rates of suicide amongst students. Can you talk to us a little bit about the programs that your organization is doing today and how digital tech is an aspect of that?
So one of the things I am so grateful as I joined the departments here is that we have taken a very comprehensive approach. And so not just focus on mental health, but more mental health and well-being through what we are calling here a multimodal approach. And some campuses are calling it what they call in the community a step care approach, which is really meeting students where they are and getting them appropriately connected to the resources best approached for their needs and acuity level. So it may be through an app. And on those apps, they may have some, at times, some videos and readings that they may feel that's necessary to support them. But they also may move up into having access to a third-party vendor where they offer telehealth, teletherapy. They may offer telecoaching. And especially for some campuses, not necessarily here, but at other campuses where they don't have therapists of color or multilingual therapists who can actually serve students in their native language. Those companies have been very beneficial to a lot of campuses who haven't been able to recruit and retain the diverse clinical and preventionist staff that is necessary to serve their students. And so moving up that ladder, technology has been very beneficial to look at our mental health and well-being approaches. And so you have the apps, you have the different third-party vendors who've offered telehealth, teletherapy, telecoaching. And then many of us use various Microsoft and other technology to offer virtual classes and workshops, and even some group fitness classes for our students while they were home. So that way they had some type of social engagement and ability to have some type of movement while they were unfortunately being either sequestered because of COVID or because they were at home, because we sent a lot of students home at the beginning of the COVID crisis. And so all that has been beneficial in serving our students, but more importantly, a lot of campuses, not only when they sent students home, sent them home with technology as far as an iPad or a Google Chromebook, but actually had to send them home with the technology to have internet services. A lot of campuses weren't aware of the technology deficits many of our students have. And so not only were they food insecure, but they were also technology insecure at the same time.
Wow. You know, when you think about, in particular, I'm going to hone in on international students for just a moment, because in many respects, they're an example of a population whom typically individuals coming into the States have limited access or no access at all to the healthcare system, unless it's through their own means and through private services that they're delivered. But on campuses, that's not the case. Is that correct?
For many campuses that have a comprehensive approach to student health, if they have a student health services, either nurse-led or through us, that is through an accredited, either through HHC or JCO accredited student health center, they have a comprehensive ambulatory care facility where they can get access to care. Some have a student fee model, some have no fee model, or some accept third-party insurance companies. And the whole purpose of college student health is about access and giving students access to care, which is a different approach than traditional ambulatory care, primary care services, which is a different approach. So students can come in, most of the time students can get access to care either same day or within a day or two, depending on the campus's model, which is a very different approach. And then again, we have EHR systems, just like many of our partners in the community use Epic or other systems. We have the same on campus. And so for international students, they are able to take the lead and advocate and make an appointment themselves and pick and choose their provider a lot quicker. And because of that, they are now in the front seat of making that appointment, and they don't have to have a person advocating on their behalf to get access to care.
You know, Dr. Elbert, that's really fascinating, but I picked up on something you said, and in the last minute, 60 seconds that we have here together, I want to hone in on that. You used the word EHR systems, plural, and you talked about multiple groups, right? Multiple types of students, multiple types of services. What does this mean? Why are you using the term systems?
There's so many systems on campuses, and so they unfortunately they all don't talk to each other. And because we support students through a variety where they're academic advisor, and they may have an early alert for students who are struggling academically, and student health and counseling may have their own separate EHR, and then you may have one through the advocate office when they are getting them outsourced to community resources. All of those systems don't talk to each other. And then I talked about the third-party vendors. They have a fee model that is per person, per student. And many of our students, many of our campuses can't afford that model. And so it's the haves and the have-nots. And so I think about our HBCUs, our minority serving institutions who can't afford those amazing opportunities to serve students who have been historically under-resourced and served. So you have all these different models, all these amazing opportunities through vendors. And again, these campuses need these things for our students, but they don't have the resources and the access to this technology. And there are very few, less than a handful, who have a different model where they don't charge per student for their access to teletherapy and telehealth or to their apps. And so we need more companies to help us navigate a different price model, and also how we can bring all of our EHRs and different types of platforms together to tell the story of a student holistically, so we can have a high level story so they don't have to constantly repeat their story across our campuses.
Well, very good. Thank you so much, Dr. Elbert, and thank you, Stan.
And I have one more question for Dr. Elbert, if you have one more minute.
Yes.
Just wondering, the Buckeyes are 15-point favorites over the Nittany Lions this weekend. Are you think they're going to cover that spread?
Absolutely, absolutely.
Wonderful. Thank you, Fran, for a terrific interview. And again, a critical point to consider when we're looking at underserved areas and we're trying to reach individuals. A lot of time with either mild to moderate, sometimes severe mental health issues. It's critical that we're thinking about new ways to engage and new ways to reach out. And whether it's a flip phone or a mobile phone that has a smartphone, we have to think empathetically. What is it that individual will most likely use as they're trying to engage with us as healthcare professionals, as public health professionals, life science professionals, and clinical professionals? And so again, an important item here. Great interview though. Thank you both.